This is West Point, one of Monrovia's slum areas. It's dawn and hundreds of women are here to get the drugs that will give them and their families 1 month's protection against malaria.
She said because of Ebola, no hospital open. So when the children get sick, what they do, they mash the pepper and then just pepper the children with air so that they can get well because there are no malaria medicine.
Over the next 3 months, 300,000 Monrovians will be given the drugs they need to protect them against malaria. These people live in the most densely populated and deprived neighbourhoods in the city. The programme is designed to prevent malaria and young children dying from the disease. However, early symptoms of malaria and Ebola are similar, so the aim is also to avoid people who think they may have hemorrhagic fever going to the Ebola treatment centres and risk coming in contact with infected patients. But organising distributions during an Ebola epidemic is not that simple, and care must be taken to ensure people don't get infected.
The first rule is to protect ourselves and all members of the team to make sure we don't get infected. We try to organize small, women-only groups. They come at dawn when most of the population aren't up yet. Over 1,000 people stand in line for hours at a time without touching each other or us. They keep a distance of about 1.5 meters to avoid any physical contact.
Similarly, another MSF team has organised the distribution of home protection kits, buckets containing protective gloves and masks and bleach.
Whenever somebody is sick, I won't run away from them. I will be able to take good care of them.
Over 16,000 kits have already been distributed. The kits contain everything families need to protect themselves until the infected person gets admitted to a treatment centre. After months of rain, many of the track roads around Korema have turned into deep clay mud. But neither the sea, too dangerous, nor the rivers, infested with crocodiles, offer feasible alternatives. In such conditions, how can we reach out to remote communities and people who may be suffering from tuberculosis? MSF decided to trial an innovative approach and used unmanned aerial vehicles to send sputum tests for diagnosing TB to Korema Hospital.
The impact is to improve considerably and drastically the diagnostic capacity, to be able to react quickly and to have a clear idea of what is the situation for the person, even if she is or he is in a remote place far from any referral hospital. It's very new and it could be a real revolution for us in terms of effectiveness of diagnostic and system.
The use of UAVs is still in its trial phase. Operated using a smartphone, they are currently capable of travelling at a speed of 60 kilometres an hour with a range of 28 kilometres. The MSF team also works in Korema Hospital. The aim is to establish within 5 years an effective model of care adapted to the context that can then be replicated in other affected areas in the country. Northern Bahr el Ghazal state in South Sudan. In a country torn apart by a political crisis lasting for almost a year now, delivering healthcare has become an ongoing challenge, even in the West, so far unaffected by the fighting. Most health facilities are short of anti-malarial drugs. The conflict is exacerbating a supply chain that was already in disarray. The Ministry of Health's partner organisations haven't been able to set up effective distributions of rapid diagnostic tests and drugs to peripheral health centres. In some areas, there are virtually no health structures capable of treating malaria patients.
It's very, very discouraging sometimes to receive people who are very sick, and they are sick with the diseases that we can treat, but they come in late stages. So one of the most discouraging things we find is that people come in terminal stages and we have lost lives because people are coming when they are very sick.
Some patients have to travel several hours or even days to get medical treatment. Although it has 5 medical facilities in the west of the country, MSF cannot respond to all the people's health needs. Transmitted by the triatamine bug, Chagas disease can develop in the body for years without any symptoms appearing, and it's during this silent phase that it is easiest to treat. Over 1,500 people have been tested in Oaxaca state since the health authorities and MSF instituted a diagnosis and treatment program. 18-year-old Ubaldo started treatment in late August after testing positive for the disease.
They told me I would get treatment for 62 days to get better. They've come to take me to the health center. I'll be going there every week for my treatment, and the doctor will give me a checkup to see how the treatment is progressing.
Chagas disease is endemic in Mexico, but a vicious circle continues to deny many sick people access to treatment.
The cycle begins when the patient goes to the doctor, who doesn't think of Chagas, and therefore doesn't diagnose it. No diagnosis means doctors don't appeal to governments for drugs to treat Chagas, and governments don't appeal to pharmaceutical companies. And as there's no demand, there's no research into new, more effective drugs.
It is estimated that more than 1 million Mexicans are infected with the disease. The goal is to break this vicious cycle by replicating the Oaxaca program across Mexico. All the children who come to Conseguela Health Centre undergo the same ritual. They're weighed, screened for malaria, and their upper arm circumference is measured. Malnutrition and malaria are recurrent here, and they jeopardise the health of numerous children. The MSF team transfers the most critical cases for treatment at the hospital in Cutiala, the main town in the district. This little boy is suffering from severe malaria and needs a blood transfusion urgently. As these severe cases of malaria and malnutrition are responsible for the deaths of many young children, the MSF team has set up 2 preventive programmes for them. The first is the administering of seasonal malarial chemoprevention to protect them during the rainy season, and the second, the distribution of ready-to-use therapeutic foods to healthy children to prevent malnutrition. These initiatives have already helped thousands of kids to grow up in good health.